Hi, I'm Elizabeth Scott, and I'm here with my coworker, Maria Villagran, and we work with Arkansas Support Network, the Family Support Program, and Northwest Arkansas Community Parent Resource Center. We want to talk with you for a few minutes today about kindergarten transition, supporting all children to participate, learn, and grow. Going to kindergarten, of course, is a big change for children and parents, and especially when children will be needing some additional supports in school. The preschool staff and environment are nurturing and supportive, and parents may feel many different emotions about the upcoming move to the new school. This may include excitement about having a new adventure, fear of change, and leaving a familiar place and people who care about you and help you and your child, and maybe anxiety about what your child may face in a new school. Today, we'll hope to give you some information and resources that can be helpful during this time.
We recognize and support every person's right to be included in the life of the community. This is our mission at Arkansas Support Network. We start thinking very early on about how all children can be active and contributing members of their community all their lives, starting with the school. Next. The Family Support Program of Arkansas Support Network began in 1988. It was a dream of 5 mothers of children with disabilities that wanted to help other families on finding resources and provide support to make sure children were able to participate in the life of the community. Next. The Community Parent Resource Centers received a federal grant to develop the Northwest Arkansas Community Parent Resource Center in 2009. We serve children with disabilities ages birth through 26. We provide and give information about how we can support to help navigate the special education system. Arkansas Support Network is a nonprofit agency and our services are free of charge. Next. In today's training, we hope to help you increase participants' understanding and learn a little bit more about the individuals with disabilities education at the IDEA, the special education services in public school, the individualized education program, IEP, and the transition process and ways that parents can work to support children during this transition. Next.
So this has been a school year like no other. The school districts have had to work very hard to keep the education process moving and try to prevent gaps in learning for young children, as well as students in grades K through 12. Children entering kindergarten next fall are going to get the benefit of these efforts. School districts have different ways of doing things depending on their policies and the way they interpret the State Department of Education policies. So it's good to get familiar with the school district where you live.
All children are part of the whole school, the community, or their school and district life, the community life. Don't assume that your child's disability or need for support will limit them for participating and making their contribution to their life of the school. Parents can think about their vision for their future and inform yourself about the special education process. Keep an eye for every possible way that your child can be included with the right support in the daily activities of the school. Next. The Individuals with Disability Education Act, IDEA, is a federal law that gives schools They receive federal government funding, guidelines, and rules to follow to make sure that children ages 3 to young adult at age 21 who qualify for special education services get the support they need to access an appropriate education in schools. Your child may be receiving the benefit of IDEA in the 3 to 5 program at their preschool center now. It is important to understand what rights children and parents have under this law so that children can get the services they need in preschool and in K to 12 schools. These rights are the same in time of crisis. The National Office of Special Education Program is in the process of working with the Center for Disease Control and Prevention to figure out how to continue to open schools as safely as possible as the pandemic continues. OSEP is responsible for making sure schools follow IDEA rules to help children with disabilities to succeed and to make progress in the education goals. Schools already have a lot of experience now managing during the crisis. Though we don't know how everything will look in August as fall classes start, we don't know now. Schools have a huge amount of practice with new learning modes that they did not have this last fall. Next.
So preparing ahead of time for transition to kindergarten is great for parents and for children. It lowers stress levels, makes the possibility of a more successful start to kindergarten a lot more likely because of just having some information ahead of time and feeling more confident that you know what to do and where to go. So just learning more about navigating the special education as well as the regular education process can really give parents some more, just make you feel like you have a more solid footing to stand on to support your child. So we like to suggest that parents write down concerns that you may have so that you can kind of see on paper what you, or in your preferred digital mode, just putting your thoughts down as far as what your main concerns are for your child going into kindergarten. And also is your dream? What's your hope? What are your hopes and dreams for your child as they enter public school, and what would be the best case scenario that you would hope for them? So if your child attends a preschool center, then the preschool staff can help you know what to do. Most likely you are already in some stage of the transition process to kindergarten. And so the people at the center are going to be able to help give you the support that you need to understand what's going on. The Northwest Arkansas Education Service Cooperative is a public school agency that's responsible for making sure that all children ages 3 to 5 who need special education services or who may need them are receiving the services that they need or the evaluations that they need. And so if you chose the co-op education co-op services as support within that preschool center, then the co-op will be helping or has been helping you with this transition process and scheduling meetings with the school and that sort of thing. If you didn't choose the co-op services, then the center staff will be able to support you in the transition process just fine, and you can direct questions toward them. If your child spends their days at home and doesn't attend a preschool program, you can talk to someone at the school nearest your home and ask who you should contact if you feel your child is going to need some additional supports at school. Maybe they receive therapies, there's information that you want to to make sure that the school has before kindergarten starts. Then make sure to contact the school as soon as you can to let them know that you can, if that becomes a difficulty, or if you are not sure what to do, you can also call the special services office in your school district and ask what to do. And there should be a person there who supervises or works mainly with the kindergarten transition. So I mentioned the Northwest Arkansas Education Service Cooperative. Their office is in Farmington, and they do provide support for this transition. But like I said, parents can talk with the local school, or you can talk with the preschool staff if you don't have those that additional support. And it's so important to make sure that you ask the questions that you have to the people that are familiar with this process. So, lots of times parents want to know, how long is my child going to be able to stay at the preschool center before they go to school? Is there going to be some sort of a break period, or is it going to go right up to time? We know that children who maybe have difficulty with changes or really depend on a steady routine benefit from attending the preschool program or having some kind of a set routine right up to time for school, so that there's not any kind of a break there that might confuse them as they're trying to adapt to the new school routine. You may have other questions like that have to do with what's coming next in the transition process. How is the center going to be helping you? Who's going to be helping you in the center? What's the next conference going to be about? Make sure you ask all of your questions. If you have concerns about if your child maybe is not toilet trained completely yet, or maybe has some difficulty with communication skills and you're concerned about that, talk with the center staff about that. And we're also going to cover some more information later in this presentation that might be helpful. So the kindergarten waiver gives children who are eligible the chance to continue attending their preschool program past the age of 5 instead of going to kindergarten. So that's something that you might want to address with your preschool staff if you have some concerns about your child entering kindergarten. The public schools are very prepared to receive children who need additional supports and services. But again, that conversation, is important to have if you do have the concern that your child might not be ready. If a child is able to attend the preschool center an additional year, and each center will be different, then there's still going to be a transition conference. We'll talk about those conferences shortly, and most likely around their 6th birthday. Now, when a child turns 6, for example, special education services with the education co-op will end because they serve children ages 3 to 5. So this additional year, there might be a potential gap in special education services. That would be something you want to talk with the preschool center about. And if the school that your child will be going to, if that district doesn't provide services to children who are not in the district yet, then there might be a space there in services, but the preschool center may be able to continue providing appropriate services during that time. Mainly, it's just something that will be important to address with the center. So the kindergarten transition process involves a couple of transition conferences, which are meetings with parents, public school staff, maybe the education co-op if they're involved, and preschool or center staff. You most likely have already had a first conference, typically in May. The second conferences will be scheduled, and if you view this training past that time, then you may have already had your second conference, and we'll give you some additional information that might be helpful as the next few months come around. So the first conference involves referral for special education process, talking about a child's strength and needs and consent for additional evaluation. That referral is to the public school system, so that then the eligibility process can start to see if your child is eligible to receive special education services. The second conference will, in the second conference, the team is going to review evaluation results if there's been some additional evaluation and the data, and pull that together to see if your child qualifies for special education services in kindergarten. If they do, then the team will develop an individualized education program and talk about options for services.
Preparing for transition conference, make a list of your questions with ahead of time so you will not forget them. Invite someone that you trust to attend with you and can support you. Ask for a time that works for you. You can always ask for a time that works for you. Be sure to connect and to arrive on time. These suggestions can work for any meeting you attend with the school, personnel, or anyone who provides services to your child now and in the future. This is the time to talk about all your concerns and why you and the teacher observe to be your child's strengths and needs. Talk to your child's preschool teacher before the meeting about academic skills and how things are going in the classroom. If your child has difficulty with new situations and changes in routines, you can ask what safe activities may be coming up in the spring to help children get to know their new school. In each conference, now and in the future, your concern, questions, and ideas are very important so that the school can support your child. Parents and teachers are very concerned about the issue around the pandemic precautions. Don't hesitate to ask for details and for contact information of staff available to answer further questions. Later on and in the summer, if your child uses a special equipment like a wheelchair or hearing aids or has other needs, be sure to let the preschool and school district know about each transition conference. The district, for example, will need to make sure your child can use the school entrance, move around the school, and access the restroom or other aspects of the building or educational activities. Next. Talking about additional testing, the school may want to do more testing if they do not have enough information from the preschool center to meet their criteria. This is part of transition, and you will be asked to sign a consent form in the first conference. Having enough information about your child helps the team to know what services will fit their needs. The school staff will let you know where the testing will take place. After testing is completed, the second conference will be scheduled to go over the results. Next. All children must receive an education, regardless of the level of support that they need. Typically, in the second transition conference, the school will share any test results and let you know if your child qualifies to receive special education services based on their criteria under IDEA. The school should, on average, be able to serve about 80% of the students in the regular education program. So if your child does not qualify, there are still services that can give support to your child. For example, the pandemic has made it necessary for schools to focus even more on the emotional well-being for all the students, as well as taking CDC and Department of Health requirements precautions to protect students and teachers during this time. Next.
So if your child does qualify to receive special education services, then an individualized education program, or IEP, will be developed based on what supplemental aids and services they need. So the IEP says what goals will be set and what work needs to be done to support children who qualify for special education services to receive an education. And each IEP is based on what that individual child needs. So the special education team, which includes parents or guardians, people parents want to invite to attend with them to the conference, teachers, therapists, other school personnel. And this team talks about and develops the IEP together. This can be called programming. It's what the team will do to help your child. So the team's job is to listen to all concerns and develop goals around the child's strengths and needs. So the family helps the school staff to understand their child and advocates for what their child needs. And so your role as a parent is so important to be able to make sure that all the members of the team know what works for your child, what they've learned, and what more you feel like they need to learn, as well as what particular supports that they may need to be successful and comfortable and be able to learn and grow at school. All of us learn better if we're interested in doing something, something that we like or enjoy. So it's really important for the team to know and to focus on your child's strengths and interests, what they like to do, what they're drawn to. And goals can be built around those things so that there's some good motivation for learning and to continue the progress that hopefully you've seen in the preschool program. The school will probably have a draft of a proposed individualized education program at the second conference to talk over with you. It's only a draft, and it should be added to as new ideas come up in the meeting as the discussion progresses. And this is true about any ongoing conference around special education and your child's IEP. If they continue to qualify, there's a yearly meeting, an annual review, and that discussion and the draft of the IEP is always a draft. It's always flexible and able to be changed and worked with to make it work for your child. So the IEP is a legal document and protects your child's rights under IDEA. We always emphasize to parents that having everything in writing assures that everyone knows what to work on with your child and understands their circumstances and individual needs. So it's really important for parents to keep a copy of that for your records so that you have it ready if you have questions about it. So again, it's flexible and can be changed at any time during the school year. So if something's not working as well as you or the teacher would like, then you can call a conference. You can ask for a special education conference to sit down with the team and to talk about concerns or ideas. This is a tool, a very important tool that parents have under IDEA to be able to do a continual problem-solving process so that you don't have a concern and it goes all the way to the end of the year when it's time for the annual review. That's not what needs to happen. You can go ahead and ask to meet together so that that team can work to help your child be successful. It also gives you the opportunity to know your child's team. And so coming into kindergarten and getting a few weeks under your belt, and letting your child get adjusted to the classes and the schedule. If you would like to ask for a meeting to bring the team together, like in September, or 1st of October, whatever you think would be best, then you have the ability to do that and to know what's happening with your child at school. It's always okay to ask someone to attend with you if you want someone to help you take notes or to ask questions or just to witness the conversation so that they can help you remember what you've learned at the conference. But it's really important for that support person to be there, ready to help brainstorm and work with the team as much as possible along with you. So check the goals on your child's individualized education program as they're being discussed, and make sure you understand what they say. What is the work that's actually being done with that goal? And you should be able to read the goal and understand exactly what the work is that the teacher should be doing, because we want everyone that reads those goals to find them to be clear and understandable and also measurable. So there should be 3 out of 4 times or an 8 out of 10 times your child may respond in the desired way in order to keep progressing. And so you'll be receiving, if your child has an IEP, in the coming year, your child should receive you should receive reports every 9 weeks about the goals on your child's IEP, and watch those percentages and the reports to make sure that you see progress. So this is a really good tool for parents to use. Parents have the right and responsibility to weigh in about the work the school is going to be doing with your child. So a couple of additional things that we want to mention around the IEP. Just in general, some children don't respond the same as some of their peers to teachers' behavior management style. So there may be some children in the classroom, whether or not they receive special education services, that may need some adjustments of the behavior management style of the classroom. You can help by suggesting activities that motivate your child, making sure the teacher knows what maybe sets your child off or upsets them or makes them uncomfortable, and what you do at home in order to help them to calm and to feel better. Challenging behaviors are a way of communicating needs or wants that a child may have difficulty expressing. So it's super important for parents and teachers to listen to what's happening and to pay attention to those behaviors and work to understand what is happening with the child, what's causing the distress or discomfort. So if a child's behavior becomes consistently challenging in a classroom and starts to impact their learning, then the school has a number of steps they can take to help. So this is, if you begin to hear the teacher say, I'm really not sure how to support him or her in the classroom, that because of these behaviors, and you begin to get some repetition of that, or you start to get concerned about some of your child's behaviors, then the classroom can, or the school can initiate some interventions in the classroom. There's usually a district level behavior specialist that the team can consult to ask for maybe a functional behavior assessment, a behavior intervention plan, and other steps that can be more formally taken to be able to help a child be more comfortable in the classroom and to learn how to respond in different situations that they're not able to adapt to maybe yet. So the IEP should be changed or adapted to include goals or plans around behavior if the team decides they need to be added to the IEP. The main thing is, and what we hope to see, is that the school personnel will continue to work to try to help that child to be more comfortable and to get back on a learning track. And so that continual problem solving process is what we want to see. And again, what those conferences are good for during the year if you see that something needs to be adjusted or worked on by the team. Another area that may cause difficulties in the classroom are sensory issues, and a lot of children who have some sort of developmental delay or other need may experience sensory issues, sensitivity to noise or light or textures, not wanting to be in groups of people, just difficulty sitting still or concentrating. And so since our senses help us to take in the world and learn, this can be really stressful for some children, and they may look for calming sensations, maybe rocking, covering ears, repetitive movements, running away from the situation. So these are very important forms of communication. A child is telling us, I need something, I'm uncomfortable, I don't know how to handle this situation. And so parents can talk with the teacher about that. Maybe a safe place in the classroom can be established to calm emotions. Frequent physical activity, whatever may work for a child, will be important to talk with the teacher about and make sure that those things are happening in the classroom. If you feel that your child's sensory concerns really need further support or something a little bit more intensive than only classroom modifications, then you can ask about an occupational therapy assessment. And that occupational therapists have some specialty typically in sensory issues and can give some information that can be helpful in the classroom. So we've talked about needs and the individualized education program, and that's programming. That's the work that needs to be done. And so the next part of the conversation is going to be where in the school or in the district will those services be provided? Who's going to provide those services to the child, and how is that going to look? In what settings or in what ways is that going to be provided? So just put a list of additional supports that may be available for children who do qualify for special education in an IEP. So now we're talking a little bit more about the concept of placement. We definitely want the program to be developed and the needs of your child to be discussed and talked about before it's decided where those services are going to be provided, because there's a broad range of options for children to receive special education services. Lots of creative ways to provide those services. They may, need extra support in the library or in the music room, in the regular classroom, or on the playground. It just depends on each child. But to provide services so that a child can spend most or all of their time with their typical grade level peers is such a priority. And you can see this list. Most of the services that are listed here can be provided or are provided in the regular classroom with additional supports. Research has shown that children with disabilities who spend a significant amount of the school day with their typical peers have a better educational and lifelong outcome. So it's something that is a big priority for children. If the special education team decides that a child's needs are best served in a self-contained classroom, or sometimes it might be called a CBI classroom, and there are other names to the classroom depending on the district and the emphasis of those classrooms. It's important to understand that these classes are separate from the child's typical grade level peers. And since every child needs to be involved in regular grade level activities and classes as much as possible and appropriate for them, the team can look for ways to accomplish that. So that's going to be a really important conversation and ongoing for parents. If you see opportunities for your child excuse me, to participate in just the regular activities of the school, and maybe see a barrier or something that you're concerned about, or you think, I'd really like for them to participate in that. How can we do that? That how question is a good question for the team or for the teacher. How can my child participate? He is really not tolerating loud noises very well, but I really want him to be able to participate in music class or in somewhere where it's noisy. What can we do, and how can the school help? Maybe headphones would help, or some other measure that would work to get your child in that typical peer group. All supports and services that a child needs should be written into the individualized education program so that everyone knows what to do.
Talking about therapies, depending on evaluation results and other information, the school special education personnel will let you know how much therapy time your child qualifies for at school. It could be that your child will receive less therapy than in preschool. This may be due to the difference between the medical model that the preschool must follow and the educational model that the school district uses. Therapies in the public school are based on what skills help children to access their education, not on medical needs. If your child, you have questions about why one of your child's therapist needs is not an educational need, ask questions until you feel you understand clearly. If it works for your child to receive both school and private therapies, this can be very beneficial for your child. Therapists at private clinics can work on some therapist goals that the school cannot. All public schools services are free of charge, including therapies. The state of Arkansas strongly encourages schools to bill Medicaid for some therapies and personal care services to help with the flow of funding. But parents do have the right to refuse permission to bill Medicaid without any negative consequences. Medicaid will not accept billing on the same day for the same kind of therapies from a school and from the clinic. And there is a cap for therapy coverage. If your child qualifies for a large amount of therapy, you might consider asking the school not to bill Medicaid. Applied behavior analysis is a therapy program specifically for children who have autism. It is a medical services, and a referral can be requested from the primary care provider to an agency that offers that therapy. Often, ABA therapy is provided in the home, but sometimes also in a clinic setting or in a school. Next. If your children experience seizures, needs to take medication at school, has food or other allergy, or has asthma, has a gastric tube or for nutrition or other medical concerns, let the team know. A health plan will be developed to make sure everyone at school and on the bus, if needed, understand how to help your child. It is really important that when you go to your meetings at school, if your child has all these medical needs or some of these medical needs, to ask for the nurse to be present during the meetings to make sure everybody knows about your child's health condition. And the nurse will write a healthcare plan that she will send to the primary care physician of your child to make sure they can follow the steps to help your child in case of one of these incidents happen at school. Next. Find out when to go to enroll your child in in which school, in what immunizations are needed before school starts. Usually enrollment will be at the school closest to your home. Paperwork and documents that are part of the special education programs for preschool and school age children are legal form and very important for your records. As a school or health issues come up, these documents are your written evidence or what has been done and said to help your child. Since our world is becoming more and more paperless, it might be that you want to store special education documents digitally. You always have a right to request special education documents from the school at any time. The main thing is to have them at hand when you need them. You may already know the local school because all their siblings or youth from living in the community. Visit the school with your child if you can. You can ask the team or call to see what opportunities you may have to meet the principal or other staff at your and maybe tour the building so your child will know where they will be eating at lunch, play in the black playground, and what the halls looks like. Due to the pandemic, there may be some restrictions that did not exist before. Next.
So, as Maria said, there may be some limitations to your ability to be able to introduce your child to the school, and that'll definitely be a conversation for maybe you at the preschool center in the school. And since the situation is unusual right now, but there are other ways to do that. As well, and especially it's especially important for children, as we mentioned earlier, that just need that benefit from familiarity, from kind of some repetition and being able to get used to new ideas and new situations. So if you can't actually go into the school, driving by and taking photos, talking about that later, here's a picture of your school. Remember when we drove by, we could see the playground. It may depend on district to district and school to school if families are able to play on the playground or take their children to play on the playground during this time. Typically, the playgrounds are public property, and so they are public property, but there may be some restrictions due to the health crisis at this time. So it would be good to address that with the school if you would like to have that opportunity. But you can also look at the school's website. There's lots of photos. Usually they post to lots of different sections where you can read about different aspects of the school and the school district, as well as events and calendar. It's really helpful to children for parents to focus on the positive, the future, the positives and the possibilities for new friends and experiences. Take care not to discuss concerns in front of your child if at all possible, since this can create some extra anxiety. But it is very important to find another adult or someone that you're able to express your anxiety and concerns about, because it's so important to also process your own emotions about the change and to be able to support your child in that way. Learning the school rules, if you can most likely find the student handbook on the website. School rules apply to all children, but certain modifications can be made depending on a child's needs. So it's good to know kind of what the general rules are, and then you can address concerns that you have. For example, maybe be ready to talk with the school if your child has significant medical needs that are most likely going to affect attendance, and so that you can understand what the policy is and let them know this is what's going on in our family, and this is what we need to talk with you about how to work with this, so that we have a good relationship and an understanding between us. Learn the parent visit policy, for example, and because that varies from school to school and district to district, and also maybe what you need to do if you need someone else to come and pick up your child from school, what the requirements for that are. Also during the summer, year-round, but especially during the summer, local libraries may have activities for children, maybe virtual, maybe some in-person social distancing may be happening, and possibly will be happening more and more as the year goes on. A librarian may be able to recommend books about going to kindergarten or other stories about, making friends or different things that might be helpful to children to kind of have that repetition and going through the pictures and talking about it together and making them more aware. So before school starts, we recommend to parents that you make a letter for the teacher. It doesn't have to be a big formal letter. You could do it digitally, on the computer, or you could just do a handwritten letter, but attached with your child's photo, so that teacher, the first day of classes, knows what your child looks like, and that photo is attached to some information about what your child may need. It's you will have gone through the conferences, the 2 conferences, and lots of information will be shared, and that information will be passed along to the teacher. But teachers are also working with a lot of different factors and moving parts at the first of the year. So it's good not to assume that teacher will have all the information that they need that very first day with the other things that they're also working with. So to provide that information with the photo and information, if your child uses special equipment, if things about allergies, anything that you can think of that would help a teacher the first day, the first week, to get to know your child quickly, and to also have your contact information so that they know how to reach you immediately if they have some questions. Also in some districts, if the team is determined as a team that your child will benefit most from special services in a self-contained classroom, then an appropriate classroom might not be available in your home school, in your local school. And so the recommendation may be that your child attend another school that houses those services that are best for them. And so the school should provide special transportation for that. What we find happens in some districts is that before school starts, it may kind of take longer than teachers and parents would like to know exactly what school that child is going to be attending. So getting that contact information, who can I talk to in the summer? What if I have questions and I feel like I don't have enough information? Who do I call? When you go to your conferences and before school ends in May, to make sure you have some contact information to be able to ask questions if you have any concerns before school starts. Just remembering also that all children coming into kindergarten need support. It's a new experience for all the children, and those kindergarten teachers are aware that there's so many details the children don't know how to do. Maybe they've gone to a preschool setting, maybe they haven't, but all the kids are coming in needing support. And so there's going to be that attitude of welcoming and helping them to understand what to do. Maybe knowing what school supplies you need, if you can get that information ahead of time, and also finding out how to get the lunch menu, especially if you have allergy concerns for your child, that you may be able to check that out. Pick up and drop off. If your child is a walker or car rider, you could do some practice runs and make sure that they understand, what's going to happen, and talk about it. And then if the transportation system, if you're going to use the bus, then talking about that, and also making sure that you understand how that process is going to work.
What can you do to help your child be most successful? When parents stay involved with children at home, it continually supports children's learning at school. spending time together, reading books, doing chores together, establishing a family routine, giving encouragement, using the TV and computer wisely, keeping in touch with the school. You and the school personnel are an equal member of the team. Your participation is very important because you are the expert when it comes to your child. And don't hesitate to ask for help. The school system and special education system program can be confusing for anyone. Look for an educational advocate or a professional that you trust in your community to help you navigate the system. Just remember that you know your child better than anyone. So ask questions anytime that you feel you're confused, and be an active member of the team. Express your opinions and give your input. Next. At the beginning of the school year, ask the teacher to let you know if it is better to call, text, use the school digital communication system, write a note to put in the backpack, email, or meet in person. Ask about a method that works for both you and the teacher. Teachers are extra stressed at this time. They are working to implement COVID precautions, as well as sometimes working with the students, both in person and at home at the same time. So communication between parents and teachers may be more challenging right now. It continues to be very important so that you can work as a team. Next. What happens when accidents, cuts, bruises, or some mishaps happen? Like in preschool, it is important to know the school procedure for accidents, both minor ones and emergencies, and be ready to communicate with the teacher as soon as possible. If you are not notified that your child has fallen, been hurt, bruised, or scratched, or had an accident, it is important to communicate as soon as possible and as calmly as possible with the school personnel so that you can get the most current and correct information about what happened. And don't hesitate to ask or make sure you get an incident report in writing for your records. Next.
So there may still be ways to volunteer during the pandemic, and we talk a little bit about parents volunteering because it's just shown to be so helpful to children and for their educational outcomes, for parents to be involved with the educational process and with the school. We know that there's going to be some limitations at this time, but as things progress, this is something to keep in mind. If you are a little bit more connected with the school and have that opportunity to be in the school or to be able to support the teacher maybe in ways that they need help, then you get to know the teachers better, and you get to know kind of what the environment of the school is like, how it feels, and it also gives children an opportunity to see their parents involved and interested not that parents are not interested in education, but being more connected, I guess would be a way to say it, with the school, being aware of what's happening. And it gives parents the chance to have more familiarity with the teacher and with the teams that you work with around the school. And then this helps when you need something, when you have questions, then you're going to be talking with and interacting with people that you're more familiar with because of that opportunity. And it just helps the school as well for parents to have that for schools and teachers to have that extra support. So this is most likely going to be kind of an ongoing situation as far as determining what would be most useful or helpful, and just to be able to check in with the teacher to see if that would be something that would be useful to them. So we always like to recommend a couple of parent centers, some online information that we find useful and very credible and solid information. The PACER Center, which is the Parent Advocacy Coalition for Educational Rights, and also the Center for Parent Information and Resources, the Parent Center Hub. There's a lot of good information, articles and videos, and help for parents to get to expand on the information that we've presented today and answer more questions about the educational setting and special education. So also understood.org is a good website for people with learning and thinking differences. And there's a lot of information for parents there. The Arkansas Governor's Council on Developmental Disabilities is an Arkansas agency that has good information in disability rights of Arkansas. Is also a good contact if you have further questions. You can check out their website as well.
On this slide, you'll see the survey link where you can evaluate the training that you just watched. This helps us very much and only takes a few minutes to complete. We really appreciate your help, and everyone's names will be kept anonymous. This will be used for grant reporting purposes.
So as Maria mentioned earlier, you are the expert on your child and you are your child's best and strongest advocate. We hope that the information we've shared today has been helpful to you. Please call us or contact us if we can be of assistance now or in the coming year. Thank you for your attention today.
Thank you.